Oftentimes parents are really confused about sleep apnea and they don't really know what it really is. They call sleep apnea obstructive sleep apnea. And the reason why they call it obstructive sleep apnea is because the airway, which goes from like here to here, is getting blocked. And the only thing that's really in the mouth or in the throat that can block the airway is the tongue. And so what's occurring with these kids is at nighttime, their tongue is not staying in their mouth and it's ending up in their throat, and it's causing them not to be able to oxygenate properly. What's supposed to occur is kids are supposed to, well, everybody really is supposed to breathe air through their nose, and then the air is supposed to go up and then down the throat and finally into the lungs. If the tongue is going back into the throat and not staying in the mouth, and it gets in the way of the airflow and partially or fully blocks the space, that's what causes the obstructive event and causes a child not to be able to oxygenate properly. Oftentimes what you'll see with these kids is snoring, teeth clenching, and they'll be rolling over to the side, they'll be mouth breathing, in the mouth, or there might be loud air sounds. The loud air sounds and the mouth breathing is just because when kids go to breathe through their nose, if they can't get enough air to get past that partially or fully blocked space, the mouth is a bigger hole. So they have to open up their mouth and then they breathe in hard because the space is like blocked or tight. And then that sucks everything in the mouth back into the throat. So literally what's occurring is the tongue is getting sucked back into the tonsils and all the other tissue in the throat, and it's just flapping around like collapsing. What we need to do is we need to figure out a way to keep the tongue in the mouth, and what the tongue's supposed to do is it's supposed to stay suctioned up onto the palate, so it has to kind of lift up and out of the throat and maintain light suction on the palate. And that's what keeps the tongue from falling back into the throat. Way to correct sleep apnea in kids and adults also is to figure out a way to strengthen and train the tongue to stay up on the palate. An important thing is to create the conditions where the tongue will actually stay up onto the palate. So one of the other things that we do in our office to correct pediatric sleep apnea is to create customized expanders that can get the mouth to grow wider and more forward to create space for the tongue. We also will diagnose tongue tie conditions. Sometimes kids will have attachments to their tongue, and the tongue attaches to the bottom jaw, and if it's really tight, that will make it very difficult for the tongue to lift up onto the palate. So what we'll do is we will take a look at the size and shape of the mouth. We will take a look at the tongue, and we will diagnose these tongue tie issues and issues where there's not enough room, and that's how we'll correct the pediatric sleep apnea.